Thank you to Chairman Buchanan and Ranking Member Doggett for holding this important hearing. After just 10 months of full Republican control of the federal government, they have moved with unprecedented speed to pass Trump Care, to drive up costs, healthcare costs for American families, and to jeopardize healthcare access. Trump Care enacts cuts that would cause millions of Americans to lose their insurance while saddling millions more with higher costs and new red tape. Trump Care cuts more than $1 trillion from our healthcare systems at the expense of hospitals, providers, and patients. Trump Care allows major cost increases for Medicare beneficiaries, and Trump Care slashes funding for clinical trials and other critical research. Long story short, Trump Care and Republicans' war on health care knows no bounds. Mr. Connell, I feel like my Democratic colleagues and I have been beating the drums, sounding the alarms, raising the flags all year long on the necessity of protecting health care, and one of those areas is extending the advanced premium tax credit. As you stated in your written testimony, coordinated care is a well-intentioned goal. For many Americans, any health care at all will soon become a luxury that they cannot afford. One of the most serious consequences of allowing the advanced premium tax credits to expire is the direct impact on health care affordability and accessibility for everyone. Mr. Connell, can you walk us through how letting the advanced premium tax credits lapse would increase cost across states, zip codes, ages, racial demographics, and income levels, regardless of coverage type?
Yes, so most immediately, folks who are on the exchanges, and it differs a little bit depending on income, since it's a sliding scale, would face increases in their costs. And so there are some folks who might be able to cut back on things here and there and just could barely hold on and pay their premium and keep their coverage. Hopefully they're able to spend out of pocket then to get the care that they actually need once they get that premium. The premium is only the first step. There are other folks who will be unable to bear this cost. There's folks facing, and I mentioned it in our testimony, Kenny in North Carolina, he's facing $1,500 a month increase. A lot of folks who just can't afford that at all, they will have to forego their coverage. They can't make the math work. So as folks then lose their coverage and have to go to the ER or try to get charity care where they can, that does add to the cost that we all pay. All of us who are left in the system with insurance have to cover in some way or another those costs. And it's the tragedy is that they both don't get the care that they need and that we suffer those higher costs, all the rest of us.
So the reality is it affects everyone, regardless of where you're from, whether you're a direct recipient of the tax credits or if you're just connected one way or another to the healthcare system. In October of 2025, the Social Security Administration announced a cost of living adjustment of just 2.8%, which is about $56 per month for 75 million retired seniors and disabled workers who are already struggling with higher prices heading into January of 2026. At nearly the same time, the Centers for Medicare and Medicaid Services announced that monthly Part B premiums will rise $202.90, one of the largest Part B increases in the program's history. To put that in perspective, seniors face a 9.7% cost increase compared to a 2.8% COLA bump. How can we realistically expect seniors, many who are already living paycheck to paycheck, to eat that difference? That's why I, alongside Representative Larson of Connecticut, am introducing the Social Security Emergency Inflation Relief Act to help seniors weather the rapidly rising cost of President Trump's economy. Our bill would provide Social Security beneficiaries with the $200 per month emergency increase in their checks from January through July of 2026. Mr. Connell, I know this is a bit outside of your direct area of expertise, but can you speak to how rising cost from essentials, food, transportation, housing, and health care affect seniors' ability to access the care they need while living on a fixed income?
Yeah, I'll just say the Medicare program already requires extraordinary out-of-pocket costs for a lot of patients, particularly folks who have a serious condition, whether they need expensive medication or whether they need expensive care at a hospital or another physician office. And so they already have a lot of high out-of-pocket costs. So adding premiums, higher premiums to that, in addition to the higher cost of a lot of other things in our economy, is a huge challenge for those who are already just kind of struggling to get by.
Thank you. I hope that we'll be able to take immediate action on this bill to give the relief to seniors on Medicare. That should be a priority, as should extending the premium tax credits under the Affordable Care Act. With that, I yield back.